In today's video, we're going to talk about pregnancy care. P for pregnancy. Hi everyone, today we're going to talk about pregnancy. We got my lovely wife here, and as you can see, she is pregnant. We are a little over 31 weeks, so about 9 weeks to go before our little Vinny arrives. So I'm going to go over basically the type of treatment that we would do for someone that comes in the office that's pregnant, and some of the soft tissue work that we would do, some of the adjusting styles that we would do, and then usually into the third trimester they will typically experience some lower back pain. So I'm actually also going to show a taping method with kinesio tape that we can help support the belly a little bit more, so it reduces low back pain and stress on that area. So first of all, we have the table here. I'm going to set it up in a way where she's actually going to be able to lie face down on the table. We're going to separate the table here so you can see that this piece moves down, this piece up top moves up, and then this piece in the middle actually drops down. So our belly is going to be positioned here, so there's not going to be any pressure on that area, so it's nice and safe for her. Her pelvis is going to be supported right here. As her chest applies pressure down here, this is also going to drop down to allow more room and no pressure on the abdomen, pelvis, or even the uterus itself. And then I'll elevate the footrest here to take some tension off of the hamstrings as well as the low back. First, we'll do an initial assessment to check and see where the tension is in the low back, if there's any tension in the pelvis or the muscles in the glutes. Oftentimes we find a lot of tension in the piriformis muscle, which is a muscle that attaches to the tailbone here and then goes out to the side of the hip. If that muscle is too tight or if it's in a spasm, it can press down on the sciatic nerve, cause sciatic-like symptoms down into the leg. So as they progress through the pregnancy, those are common symptoms that we'll see. So we'll first initially check into the low back if there's any tension in any of the muscles, the erectors through here. We'll check the joint play on both sides, the SI joints, to see if there's restrictions in there, any restrictions in the lumbar spine as well. We'll check the musculature through the glutes to see if there's tension in any of the areas, to see if we need to do any muscle releases. Also checking into the hamstrings, seeing if there's tension in the hamstrings. As the baby grows, the pelvis has a tendency to tip forward, so we have that anterior pelvic tilt. When that pelvis tips forward, that anterior pelvic tilt, a lot of times we get tension within the hamstrings. So we'll find some trigger points within the hamstrings that we can do some muscle releases as well. We'll also do a check to see tension within the sacroiliac joints. This is part of the Webster protocol, checking to see if there's restriction in one SI joint compared to the other. Normally find a pattern where one side is a little bit more restricted than the other. Through her pregnancy, her right SI joint has been a little bit more restricted. So with the mobilization of that joint, what we're going to do is we're going to apply pressure over the SI joint itself and apply the force directly through that joint. As I'm applying pressure downward, I'm going to block the opposite side so that opposite side doesn't move. And then as I'm applying that pressure, I'm going to have her walk her hips up and down the table to help mobilize that joint. So I'm going to apply the pressure downward. I'm going to have her mobilize up and down. So I'll have her walk through this until I feel the joint release and mobilize the way I want it to. After that point, normally I'll go through scanning the hamstrings, finding different areas where there needs to be releases, and I'll simply apply some pressure into them to help with relaxing of those muscles. Same thing going into the glutes and the piriformis muscle. I can apply direct pressure to help release those muscles. There's different forms of muscle releases that we'll utilize. Do some trigger point releases. You can do a passive release where I'm applying pressure and moving the hip through a certain range of motion. And throughout the whole treatment, by allowing them to lie on their belly and letting the table drop out like that, takes a lot of stress and tension off the low back. So most of the time, lying down in this position is not a position that they have been able to do throughout the pregnancy. So by allowing them to do it in the office, because of the table, it helps with taking that pressure off of the low back for the duration of the treatment. We can also do some lumbar pressures to help with the mobility of the lumbar spine, as well as help decrease tension through the lumbar erector muscles. I simply just have her go through just breathing in and out, and as she's breathing in, I can start to apply pressure, and as she's breathing out, I'll drag laterally to the side and go down at each level. I can do the same thing on the other side. And then another technique I like to utilize is just manual traction. So apply pressure upwards and downwards to help distract and alleviate pressure and tension within the lumbar spine. I can contact the sacrum to rock it back to allow less tension and pressure into the lower lumbar region, and hold this position and pressure for a couple seconds to help that relax. Also in this position, I can do just regular thoracic spine adjustments and mobilizations. Oftentimes with females that are going through pregnancies, the breast tissue enlarges, so there's a lot of tension, extra tension that they're typically not used to along the bra strap line. So this area typically will get a little bit more stress through the joints and the muscles, so we can do some adjusting and mobilizations through those areas. So we can do some motion palpation and mobilizations through those areas. I can do a regular adjustment. If there's tightness in the muscles, I can do some trigger point releases to those muscles as well. So then in this position, oftentimes we'll see, we look at tension within the round ligament. So if females get pain down into the groin area, oftentimes they'll notice a sharp shooting type pain down in the groin and into the pelvis or the pelvic floor. They can have it when they're coughing or sneezing, when they're moving around in bed, different times, when they're walking, standing, sitting, but that pain usually starts here and kind of radiates down into the pelvis. So in order to find the round ligament is something that helps suspend the uterus and keep it in place. If we have tightness on one side more than the other, then you can have a little bit of a torquing effect on the uterus, and that can change the position or the space that the baby has to move around and just the general position that they can be in. So in order to find that, we go to the umbilicus, so the belly button, and the ASIS, the front of the hip, and we kind of draw a line 45 degrees both ways, and that's typically where we'll find it on both sides. We can do a scan, just kind of scanning across with the thumbs to see if one side's tighter than the other. Oftentimes we'll find that it correlates, that if the restriction in the SI joint is on one side, we'll see the round ligament typically tighter on the opposite side. Doesn't always happen that way, but that's typically the pattern that it'll follow. So for a round ligament release, all we're simply going to do is apply pressure on that round ligament and hold that position as they continue to breathe. And after holding this position for a couple seconds, 30 seconds to a minute, that round ligament starts to release, and it actually feels like it kind of unravels and melts away underneath the finger. If there's pain initially with the round ligament, Sometimes this pressure alone will be a little bit tender, but then as the round ligament releases, that pain automatically just disappears. So it's kind of cool sensation. So apply pressure. Sometimes I'll check both, and then also different tensions and trigger points throughout the rectus abdominis, the obliques, and the transverse abdominis. Because those muscles are getting stretched out, sometimes we find trigger points and tension throughout those different muscles. So I can also do different pressures and releases through those areas to make it a little bit more comfortable for the mom. Also, for the thoracic spine adjustment, if they're lying on their back like this, what we'll do is we'll cross their arms over this way and then lean them over, apply pressure with our hand back here, and then roll them back onto the hand to apply a little bit of pressure downward to get that general mobilization through that same area I was talking about earlier. Also, we tend to see a lot of tension up into the upper back and neck. Just in general, a lot of people carry stress there. Like I said, with the breast tissue getting enlarged, with the belly getting enlarged, the tension into the upper back and neck sometimes increases. So we'll check those areas if we need to do any trigger point releases, any active stretching, passive stretching. We'll check all the way up into the neck in the suboccipital region. Applying pressure. Usually this one feels pretty good. And then if there's any restrictions, obviously in the neck, we can do mobilizations and adjustments to those areas too. So now I'm going to show you the 3 taping methods that I'll typically use for someone that comes in that's pregnant. The first one is this one right down the middle. That will typically do if someone does have a lot of round ligament pain. Like I said, the round ligament from the umbilicus to the ASIS, we draw that 45. It's usually right around here. So if we do a taping method over those areas, the tape has that actual lifting effect on the skin. So it allows more blood flow into the area. If there's any inflammation, it helps with getting the inflammation out of the area, as well as just generalized pain relief. The other method that I use is this smiley face one right here. So if they're having a lot of, if they have a really low belly or they're having a lot of tension in the low back where the belly's pulling forward too much, by taping this way, starting here and pulling back this way, it can help with supporting the belly a little bit more and taking stress off the back. If I want, I can have that tape go all the way around to the back so that this force is dispersed all the way around. And then the third taping method, if you want to turn around, I'll show you, is for low back pain. So if they're having low back pain, I can do through the erectors as well as one across, and I'll typically tape over the area that is most painful. If it's one-sided versus the other, I can tape more so on one side compared to the other. If it's more generalized into the low back, then we'll typically use this method as well. But there are other techniques and methods based on where the pain is or where the muscle tension is, things like that. But we'll combine the other treatments that we already showed with these taping methods to give the patient a little bit more relief.